my name's Kim and I'll be your Pilates instructor today. If you do feel pain, discomfort, shortness of breath or dizziness or any concern about your vascular access, then please do stop and seek advice. However, if none of these things happen, relax and enjoy the movement. If you do feel concerned at all at any point, you may just sit down, find a comfortable position, breathe and imagine yourself carrying out the exercises that I'm describing. Okay, let's begin. So this session is aiming to teach you how to set up good posture in standing. I'm also going to take you through some gentle exercises to help you proof that posture or maintain it through the rest of the day. So we're going to do today's session in standing. Now do make sure that you have a chair next to you or in front of you to have your fingertips on, just to make sure that you can keep yourself stable. If you're confident, then you can stand like me on a mat in bare feet. So I'll do it without the chair to demonstrate the free movements. All right, we're going to start off with the feet hip width apart, toes pointing forwards. I'd like you to scoop up through your arches. Just push down gently through your big toes. By pushing down there, you're keeping your feet in a good position, drawing up through the arch. That will activate the small muscles around the lower leg here. Soften the knees a little bit. And I mean that, I don't mean bend the knees, just soften them. Take them out of a locked position. Once the knees are soft, you're free a little bit more to move around the pelvis. It also puts a little bit less pressure on the lower back. With your hands on your hips, I'd like you to tilt the pelvis back and forth. You'll feel the tensions and strain through the lower back there, and you'll feel them maybe easing away a little bit as you move. Good, as you scoop under, use your glutes, your bottom, and as you arch your back, use your lower back muscles here. As you tuck under, also feel your lower tummy working. For good posture, we try to settle halfway in between. So if we think of our pelvis like a bucket full of water, as you tilt forwards, you're tipping water out of the front. As you tilt backwards, the water's being tipped backwards. If you think about leveling that water, we've got the bucket central. That usually means that you're tucking under slightly with your pelvis, so that should be the feeling that you have, with a little bit of tone going on through your tummy. This may be difficult with ports and catheters and things around the abdomen and the pelvis, but do your best and do not strain. Take a breath in, breathe out and sink those ribs down. Some of you may not have a problem at all, but others may find your ribs are up and out like this. Make sure you sink those down. Don't strain around the tummy to pull them down though. I want you to broaden and open out through the front of your chest. Do this gently, not forcefully, especially if you have any vascular access around there. Good. You want to think about you've got a diamond or a medallion on the front of your chest that you're trying to show off and open out the chest there. Take a breath in and as you breathe out, drop those shoulders down. Many of us notice the shoulders rising up through the day. We want those to drop down and be relaxed. Feel the elongation from the ear to the shoulder. So we have this broadening, the shoulders down. Now with the neck, I'd like you to tuck the chin backwards, not down, straight backwards, lengthening up through the back of the neck. Lovely. We'll whiz through this again because it's quite a lot of information. Feet hip width apart, knees slightly soft, bottom gently tucked under in a neutral position, ribs are down, chest's open, tuck through the chin, lengthen up through the back of the neck. And just take a nice deep breath in this position and relaxed but poised. So you shouldn't feel the tension through your body. Lovely. So some exercises to proof this positioning. Let's bring the hands onto the hips. Make sure the chest is still open and the shoulders are still down. We're taking the weight from leg to leg, so one foot to the other. Now feel what happens as you do this. Learn about your body as you go. As you take the weight onto your leg, you should feel the thigh tightening a little and the glute squeezing a little. If you don't, make it happen. Take onto one leg, squeeze up through that leg. Take the weight onto the other leg and squeeze up through there. So just bringing the weight from side to side. We're not swaying like a tree, so the upper body isn't moving. We're taking the body gently, transitioning from side to side. Lovely. Good. We're going to do some just very gentle knee bends. We're not going to call them squats, we're just calling them little knee bends. So I would like the knees to bend and straighten. So each time we come up, we're hitting that good posture. Coming up, broadening the chest, tucking the chin. So it means we're coming out of our posture, back into it again. Good. So we're able to move whilst holding good posture. That's what's important. We can't just stand there all day in a good position. We have to actually move. Lovely. Brilliant. Bring the feet just a little bit closer, a tiny bit, and lift up one heel. The knee should point forwards, the ankle should point forwards, drawing in, shoulders down, hands on your hips, and swap. So we're swapping mid-air. We're coming up onto the toes and pushing one heel down. This is where you may feel just a little bit wobbly. Have that chair close by so you can put your fingertips on it as we do this. Good. This is lovely if you have any tightness through the ankles, any swelling of the ankles. You can shift it around a little bit by moving and stretching, and it feels good. It also helps you to proof or to maintain or strengthen these positions around the knees, feet and ankles, keeping everything in line. Drawing in through here, holding your pelvis position and holding your top half nicely. Lovely. Okay, so we're going to do some work with the upper half of our body now. We can soften the knees and tuck the bottom under and hold that while we're working on the upper half. Palms facing up, elbows beside your body. Think about a soft piece of fruit between the elbow and the body there. Drop the shoulders down. We're not squishing that fruit, but we're also not letting it drop out. We're taking our hands out to the side like this. Good. Feel those muscles around the shoulder blades as you do this. They should come together a little bit. They should squeeze gently. Not dramatically, but gently. Lovely. Just be careful through the arm exercises of any vascular access that you have. Make sure that it's safe and you're not putting any extra strain on it. You can always gently do these exercises without putting too much strain or stretch through them. Don't feel you have to move through the full range as I do. On the next one, we're taking the hands out, stretching the arms out. Pause there for a second to check your position. Check your arms are in line, check your palms are facing up, your shoulders are down, and you're trying to push out as far as you can with your fingertips. Draw the elbows back in and then hands back together. We're going to repeat. Hands out, elbows in, hands back together, and continue. Do be mindful of that arm with the vascular access at all times and shorten the movements if need be. If you're worried at all, you can always miss it out. And just stand, hold good posture and breathe. Lovely. On the next one, we're going to rotate. So we push out, rotate down, rotate up, elbows in, hands back together. Just take a second to remember taking the weight back through your heels a little. It's a slightly complex exercise, and if you're distracted by any noises in the background or anything happening, just acknowledge it and then return to the exercise and try to follow the movements and the direction. Don't worry if you go wrong, just pick it back up. Lovely. On the next one, if you can manage with these arm exercises, they can be a little tiring. Take the hands out, arms out. We're going to rotate to the right. Now just notice my hips are pointing forwards. Imagine I have headlights on my hips. They are pointing forwards at all times. The temptation is to follow it. Try to resist. It's just the upper half. Elbows in, hands back together. Embrace that feeling of aching through the arms. That means you're working them, you're strengthening, and that strength will really benefit you in the future. Good. Lovely, keeping those hips pointing forwards, remembering the headlights as you go, and breathing. It's nice to breathe out on the rotation. Think about it ringing out your lungs as you rotate. Lovely. All right, just coming back down. I'd like us to do a few shoulder exercises. Okay, so we're pushing the shoulders forwards, lift, back and down. Now this could put a little bit of pressure on some vascular access around here. So do be extra careful with these. They could be done in a minimal fashion, and you could just increase the range until you feel you are doing enough. Lovely. Recheck. Feet. Soften the knees. Tuck under. Broaden the chest. And off we go again. Shoulders forwards, up, back and down. Good. Add your breaths if you like, but no pressure to breathe at any particular point. Just do breathe. Lovely. Okay, so relax the shoulders again. We're moving up to the neck. Reset your positioning, just check. And taking the head to the side and come up. Over to the other side and come up. Make sure this shoulder's down as you come over to the other side. We don't want it following the movement. Lovely. And you can expect to feel quite a lot of tightness here as you're doing it. I can myself. Brilliant. And then we're rotating to the right and center. Make sure you keep this shoulder back. Again, don't let it follow the movement. As you're going, just take your mind to some of the other positions. Don't worry if you lose your focus a little bit on the movement. It's not important. Good. And then we're going to go forwards and backwards. Now tucking the chin, no problem. That feels like a stretch. Coming up and dropping the head back may feel a bit vulnerable for some of you. So just go as far as you can and nice and strongly pull back to the center. Coming forwards again and up and lower the head back. Don't drop it, lower it back. If you feel vulnerable with your neck at any point, just slow it down and lessen the movement. Good. Just one more. Lovely. So, to finish off, let's just go back through that posture just to make sure that it goes in your head and you can take it with you for the rest of the day. Feet hip-width apart, soften through the knees, tuck the bottom under gently, ribs down, chest nice and broad, tuck the chin and lengthen up through the back of the neck. Just roll the shoulders once, drop them down. Think about just a little bit of tone between those shoulder blades. And take a nice deep breath and breathe out. Lovely. So I hope you enjoyed that teaching and learned something about how to hold good posture in a standing position. I hope you can take this with you a little bit through the rest of the day, and certainly while you're standing waiting for a kettle to boil or at a bus stop, you can just go through those little points yourself that you've learned today. Okay, take care and see you next time.